Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. In this presentation we're going to review physical assessment as a progression, starting from head to toe. And this is an adult physical assessment. So typically when we assess the face and the skull, the techniques that we're using are inspection and palpation. With inspection, we're assessing the size, the shape, the symmetry of the face, the skull, facial movements, and the symmetry of all features are inspected. Eyes, eyebrows, forehead, nose, mouth, chin, ears, and so forth. With palpation, we're looking for the presence of any lumps, injuries, soreness, masses. In the image that we can see, everything seems to be symmetrical. Here we have something identified in the hair which could be considered to be abnormal. Probably would be a good idea to be wearing personal protective equipment in the form of gloves. When we assess the eyes, we're using inspection primarily. The pupils, in reference to their bilateral equality, reaction to light and accommodation, using the acronym PERLA, pupils equal reacting to light with accommodation. The presence of any discharge, irritation, redness, abnormal eye movement are also assessed. And standardized testing, distance testing, could be used as visual acuity using the Snellen chart. Again, identifying that there is an anomaly here. One of could be many. Unequal pupils. Then we're looking at the ears. When we're using assessment of the ears, the tool that we're using is inspection. We could be using palpation as well if you were assessing any pain or any lesions. But typically inspection is what you're using, and the auricles are inspected in terms of colour, symmetry, elasticity, and any tenderness or lesions. The external ear canal is inspected for colour and the presence of any drainage or earwax, cerumen, and the tympanic membranes in terms of colour, integrity, and lack of any bulging is also assessed. But this would require an oroscope, which we are not using during inspection. Standardised testing could involve the Rennie test and the Weber test, which utilises a tuning fork to determine whether there are any hearing deficits. Discharge in that ear. When we assess the nose, we can be using the techniques inspection and palpation. Inspection looks at the nose in respect to colour, size, shape, symmetry, if there's any presence of any drainage or nasal flaring. Tenderness is on palpation, and for masses, if we can see them. The nasal passages are assessed using an otoscope, and the sense of smell can also be assessed, which assesses cranial nerve number 1, the olfactory nerve. Palpation, you can use direct palpation, as we indicated, for the sinuses, for any time of tenderness and signs of infection. Here we have an image of nasal deviation. When we assess the mouth, the techniques are typically going to be inspection, but palpation can be used as well, using a tongue blade or using a gloved hand if you wanted to inspect inside and palpate. The lips are typically visualised for their symmetry and colour. the buccal membranes also, the gums and the tongue. The mouth and throat are assessed using a tongue blade and a light source. The tongue for symmetry and movement. Teeth for the presence of any loose or missing teeth. Caries. The uvula assessed for movement, position, size and colour. And the oropharynx, tonsils and hard and soft palates are also inspected for colour, redness and any lesions. Last is assessing the gag reflex, which is assessed using a tongue blade. When we inspect the neck, we are using 3 techniques: inspection, palpation and auscultation. Inspection of the neck and head, so we're looking at movement. The thyroid gland can also be assessed in relation to size, and even asking the patient to swallow so that we can see whether the movement is normal. Also, palpation can be done of the thyroid gland, the carotid arteries and the lymph nodes and the trachea, all palpated for size, symmetry, tenderness. Auscultation is done of the carotid arteries and the thyroid gland, assessing it now for any bruise or even sounds that could be considered to be friction sounds. Assessment of the carotid artery for signs and sounds related to bruit. Then we have assessment of the integumentary system. The integumentary system consists of skin, hair and nails. And the techniques that we use are essentially inspection and palpation. Inspection, the colour of the skin, quality, distribution of hair, size and location, if there are any skin lesions, the colour of the nail beds and the angle of the curvature of the nail beds indicated by the Shamroth sign, which can indicate finger clubbing, as indicated in the diagram. And finger clubbing is a sign of hypoxia, chronic. Palpation, the temperature, moisture level, skin turgor, and presence of edema or swelling, in other words, of the skin can be assessed. There's an example of finger clubbing, extreme. When we assess the breast and axilla, the techniques that we're using are inspection and palpation. Inspection, the breasts are visualised to assess size, shape, symmetry, colour, if there's any dimpling or lesion, swelling, edema, visible lumps or nipple retractions or discharge. And this is not unique to females, it can be in either gender. Palpation, this is where the nurse or the healthcare provider performs a complete breast examination using the fingertips to determine whether there are any lumps and whether they're felt. The lymph nodes in the axillary area are also palpated, especially in the tail of Spence, for now enlargement or swelling of the lymph nodes. When we assess the abdomen, the techniques that we use are inspection, auscultation second, palpation third. And when we inspect the abdomen, we're looking now for size, contour, symmetry, the presence of any lesions. And again, it can be expected to see if there are any pulsations which could indicate the possible presence of an abdominal aortic aneurysm or lesions in the liver. Auscultation done second. This is where bowel sounds are assessed in all four quadrants, which are the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Palpation is done third, which can be light palpation, which is typically followed by deep palpation to assess the presence of any masses, tenderness, pain, guarding, or rebound tenderness. When we assess the genitalia, whether it's male or female, we use the techniques of inspection and palpation. Inspection is to look at the skin, the pubic hair, the labia, the clitoris, the vagina, the urethral opening are inspected among female clients. The penis, urethral meatus, scrotum are inspected amongst male clients. In addition to that, palpation is done of the inguinal lymph nodes, and they're palpated for the presence of any tenderness, swelling, or enlargement of glands. A testicular examination is done for male clients. Inguinal lobe enlargement. When we assess the thorax, the techniques that we're typically using are inspection, palpation, percussion, and auscultation. With inspection, we're looking at the anterior and posterior thorax, inspecting it for size, symmetry, skin lesions, and any malalignment of the spine. We're also observing the respiratory rate and the chest movements of the diaphragm in particular during respiration. Palpation can be done to determine respiratory excursion and using tactile fremitus to determine whether there's any inflammation or fluid. Percussion for normal or abnormal sounds over the thorax is also required. There's an example of looking at thoracic excursion and symmetry. There's an example of percussion used to determine whether there is any fluid or collapse or consolidation in the lungs. When we assess the lungs, as we mentioned, auscultation is important, and auscultation is using a stethoscope to assess normal and abnormal or adventitious breath sounds. Normal breath sounds are vesicular, bronchial, bronchovesicular, and vesicular. Adventitious sounds are things like rales, rhonchi, wheezes, friction rubs, and bronchi. Abnormal sounds can be related to bronchophony, egophony, and whispered ventriloquy, and these are also auscultated and assessed and documented. When the cardiovascular system is assessed, the techniques that we use are inspection, palpation, and auscultation. Inspection, you're looking now for abnormal pulsations, which are typically located at the point of maximal impact, which again is the midclavicular line in the fifth intercostal space. Or you could be looking for abnormal pulsations in the umbilical region. Palpation deals with apical pulses which may be felt, again at the point of maximal impact, which again is located in the midclavicular line in the 5th intercostal space on the left side of the chest. Auscultation, you're listening for S1, S2, or abnormal sounds like S3, S4, or clicks. The most important sound that we're wanting to hear are the normal, which is S1, lub, S2, dub. You may also hear abnormal heart sounds called murmurs, which typically may sound like lub, sh, dub, lub, click, dub, lub, brr, dub. It's an abnormal sound between S1 and S2. When we come to assess the peripheral vascular system, the techniques that we'll be using are inspection, auscultation, and palpation. With inspection, you're looking for abnormal colour, abnormal signs of tissue perfusion, particularly in the lower extremities. Also, we may be looking at the jugular veins. In the second image that you've got there, there's an elevated JVP, which has bulging pulsations and distension of the jugular vein. When it comes to palpation, you can palpate the peripheral veins to determine things like the temperature of the skin, any presence of tenderness or swelling, edema, especially in the lower limbs. When you're palpating the pulses, ensure that they are bilaterally equal, regular in rate and volume or grade. Auscultation, you can now auscultate the carotid arteries, and this is typically done before you palpate them. If, for example, here you heard a carotid bruit, you would not palpate the carotid artery, because a bruit indicates there's an obstruction in the carotid artery, and this may cause an issue and may cause plaque dislodgement if you palpate, and this could cause a stroke. When we assess the musculoskeletal system, the techniques that we need to employ are inspection and palpation. Inspection, you're looking for size and seeing whether they move in a normal way, which could indicate strength. You're looking for tremors, contractures, weakness, and paralysis. All joints are assessed for their full range of motion, and areas of bones, especially around the joints here, are inspected to determine if there's any deformity, swelling or tenderness. Palpation results now in the presence of spasticity, flaccidity, whether there's any tenderness or pain, or whether it initiates any tremors. Joints can be quite abnormal, especially with rheumatoid arthritis. Here, in relation to, looks like pigeon toes or some form of talipes. Not normal. When it comes to the musculoskeletal system, you can assess muscle power, grade 0, no muscle contraction seen, 5, normal. Active movement against gravity with full resistance. When we assess the neurological system, we're using inspection and palpation. With inspection, we're looking for balance, gait, motor function, which is gross or fine, and coordination. Also, sensory functioning, temperature, sensory functioning, pain, kinesthetic sensations and tactile sensory motor functioning, as well as assessment of all the cranial nerves. Balance is typically assessed using the Romberg test, which we'll review. Gait can be assessed by simply observing the client as they're walking. Sensory function is determined by touching, palpation, various parts of the body, bilaterally, either with a pen or another blunt object, while the client has their eyes closed. Similarly, hot and cold objects are placed on the skin, patient's eyes closed, on various parts of the body for temperature sensory function. Kinesthetic sensations are assessed to determine the client's ability to perceive and report their bodily positioning without the help of visual clues, eyes closed. Then you've got tactile sensory, which can include the 1 or 2 point discrimination test, which relates to the client's ability to feel whether or not they've gotten 1 or 2 pinpricks that the healthcare provider gently applies. You have stereognosis, and this is the ability of the client to feel and identify a familiar object while their eyes are closed. For example, it could be a key placed in their hand, a paper clip, a pen, and if they can identify it without any visual clues. This is the Romberg test. The Romberg test is fairly straightforward. It doesn't require any equipment at all, and typically here a positive test is an inability to maintain an erect position over 60 seconds with your eyes closed. While your eyes are open, you don't sway, you don't swagger, you aren't risk at falling. As soon as you close your eyes, this indicates you've got some disability neurologically. Assessment of the neurological system. You've got a number of different reflexes, which again, for example, include the pupil reflex, the plantar reflex, the biceps reflex, the triceps reflex, the brachioradialis reflex, the patellar tendon reflex, and the calcaneal reflex. Other reflexes that I've included down there could include the gag, sneeze, blinking, cough, and yawn reflex, which you can review at your leisure. The reflexes that you can see there, the bicep reflex, the tricep reflex, the calcaneal reflex, also known as the Achilles reflex, the brachioradialis reflex, the patellar reflex, and the plantar reflex. I think it's probably important that we review the 12 cranial nerves. Now, we have 12 cranial nerves. The first is the olfactory, second optic, third oculomotor, fourth trochlear, fifth trigeminal, sixth abducens, seventh facial, eighth acoustic, ninth glossopharyngeal, 10th vagus, 11th spinal accessory, and 12th the hypoglossal. If we look at them in a little bit more detail, this is what we have. We have the olfactory, which is important because it transmits the sense of smell from the nose. And by assessing it, the person, client, patient should be able to determine what the smell relates to. Then you've got the second cranial nerve, the optic, and this transmits the sense of vision from the retina to the brain. And this can include the visual acuity test, the visual field test, visual reflexes test, colour perception test, and the fundoscopy examination. There's an example of testing visual acuity using the Snellen chart. Here's an example of now the visual field test using the Snellen chart again. Here's an example of visual acuity, where now we're looking at the field of vision. Upper, lower, right, left. Again, the visual acuity test in relation to field of vision. Assessing ocular movement. Here, visual reflexes testing. Colour perception test. And again, fundoscopy examination. All assessing cranial nerve number 2, the optic nerve. Then we have the oculomotor, and this is to do with eye movements and pupil and ciliary muscles. And the third cranial nerve essentially allows movement of the eye muscles, constriction of the pupils, focusing and position of the upper eyelid. However, it works with the other cranial nerves. Then you've got the trochlea, the fourth cranial nerve, which innervates the superior oblique muscle movements of the eyes. And in each eye, the superior oblique muscles function as in the trochlea. The trochlea nerve innervates this muscle to lift the eyes so you can look down. The nerve also enables you to move your eyes toward your nose or away from it. Giving you full range of movement and vision. Then you've got the trigeminal nerve, which is the fifth one, and this controls the muscles for chewing food. You've got 3 sensory divisions: ophthalmic, maxillary and mandibular, and they're all evaluated. And this can be used using a pin, the pinprick test, to test facial sensation. It can also use a wisp of cotton to evaluate the corneal reflex. And the corneal reflex essentially is your blink reflex. Then you have the 6th cranial nerve, the abducens. And this controls abduction of the eye. Abduction, movement out. Abduction away, using the lateral rectus muscle. So therefore, again, it determines movements of the eyes, and the patient is asked to follow a point with their eyes, commonly with a tip of a pen or a finger, without moving their head. The 7th is the facial cranial nerve, and this controls facial movements, salivary glands and the tongue. The patient is asked to look up or wrinkle their forehead, inspect for symmetry, ask the patient to close their eyes tightly. You look for incomplete closure or incomplete burying of the eyelashes on the affected side. You can also observe the nasolabial folds and the mouth while the patient is concentrating on the eyes. You're looking for symmetry. Then you've got the 8th cranial nerve, the acoustic. This is also referred to as the vestibulocochlear, and what it does is applying sensory senses to hearing and balance and equilibrium. And typically, screening is done using the Rennie test or the Weber test. Also, the whisper test can be used. Then you have the 9th cranial nerve, which is the glossopharyngeal. And this is to do with taste on the posterior of the tongue, and it involves the parotid glands as well. Now, to assess the taste impairment, the doctor will use bitter or sour substances to test the posterior 1/3 of the tongue. The patient's overall sensation and taste on the posterior tongue can be tested to determine whether the glossopharyngeal nerve is working effectively. Bitter and sour substances, posterior tongue. Then you have the vagus nerve, which does a lot of things. But in this situation, the cranial nerve here, it controls laryngeal and pharyngeal muscles, but major organs everywhere. Heart, lungs, bowel, etc. But to test the vagus nerve, we ask the patient to say ah, which will cause the pharynx to elevate, and you observe the position of the uvula. When the palatal muscles work properly, the ah sound should be clear and the uvula should not move to one side. It should just move up. Then we have the 11th cranial nerve, the spinal accessory, and this controls your trapezius and your sternocleidomastoid muscles in your back and your neck. And when you're assessing the trapezius, you ask the patient to shrug their shoulders against resistance. Any accessory nerve weakness will be present with a weak or no resistance force. And finally, the 12th cranial nerve is the hypoglossal, which controls the movement of the tongue, speech and swallowing. And you can examine the patient and ask them to protrude their tongue, move their tongue laterally, place their tongue against their cheek to resist the opposing force of the examiner's hand that's resting on the external cheek. Now, in conclusion, I think we look at assessment of the rectum and the anus, and in this situation you're using inspection and palpation. The rectum and the anus and the surrounding area are examined for any anomalies, things like, for example, hemorrhoids, bleeding, anomalies. When you're palpating, you use a gloved hand and the rectal sphincter is palpated against resistance for muscle tone and the presence of any blood, tenderness, pain or nodules. Now, let's review general survey again. A general survey is the first impression that the healthcare provider has of a patient's well-being. And note, as mentioned in other Learn Shops, 70% of physical assessment is inspection. And in the general survey, we look at the whole person. And typically the 4 areas in the general survey are physical appearance, body structure, mobility, and their behaviour. Physical appearance. Remember what I said. What you see, hear, smell is what you know. If you don't know anything, you won't know what is abnormal. You've got to know what is normal. So when you look at physical appearance, is this normal or not normal? Is this normal or not normal? Body structure. You're looking at the position. Is this normal or not normal? Is this normal or not normal? What you see is what you know. Mobility. Is this normal? Is this abnormal? Behaviour. Is this normal or is this abnormal? When it comes to a functional health assessment, you're looking at mobility, activity, exercise. So for example, functional assessment means the patient's ability to move around. Can they sit up, sit down, stand up, walk? Activity and exercise refers to, can they walk, swim, perform things like yoga, strength training? Assessing the amount of exercise. What do? Walk to work? Is it a physically demanding job? Think about lifespan considerations. Mobility and activity depend on a patient's health and illness status. Mobility can be problematic for patients who are ill or aging, increased falls risk, self-care deficits. So when you assess a patient's mobility, you assess them to see whether it affects their ability to perform activities of daily living. Functional assessment, as an overview, you look at the general health state: weight gain, weight loss, fatigue, weakness, malaise, pain, usual activity. Do they have any things like fevers or chills? Nutrition and hydration. Are they malnourished? Are they obese? Normal daily intake, their weight change, whether they're dehydrated, dry skin, excess fluid, shortness of breath, edema in the feet. What are their diet practices to promote health? As an overview, we would look at skin, hair, nails. We would look at their head and their neck. We would look at their nose, throat, their mouth. We would look at their eyes, their ears. We would examine and evaluate their thorax and lungs, their heart, neck vessels, the peripheral vascular system. Breast examination, male or female, important. Abdominal and gastrointestinal, their abdominal and urinary systems. Their musculoskeletal system, neurologically. Whether they have an endocrine or hematological system issue. The male and female genitalia. And in conclusion, their anus, rectum and prostate. Okay, thanks a lot. If you found this to be of any value, please recommend it to others and subscribe so that you get other notifications of the Dr. Manny Learn Shops. Take care and God bless.